Welcome back. I'd now like to welcome our next two panellists who will discuss health and the social network, the role of new media in cancer communication. Now, our audience, as ever, is invited to ask any questions through the live question forum on the Summit platform. We will have a Q&A with our panellists at the end of this session, and I'm actually going to be a panellist on this as well, so it'll be interesting to see how I ask questions to myself. But anyway, we will get there. First of all, Vish Viswanath is a professor of health communication in the Department of Social and Behavioral Sciences at the Harvard Chan School of Public Health, and you also work with the Dana-Farber Cancer Institute. And also we have Emmanuel Collin, who are the Director of Communication and Information at the French National Cancer Institute. Welcome to both of you. Both of our guests are health communication experts, and we're going to start the conversation actually by speaking to you, Dr. Vish. I know you've written on communication inequalities. It's fair to say, I'm sure, that throughout this pandemic, the COVID-19 pandemic, there has been an epidemic of misinformation, and not just within the health sector as well. I mean, I can talk to journalism on that point as well. But is this epidemic of misinformation a new thing when it comes to health, in particular to cancer?
No, it's not new. I think, as you know, we have always had misinformation and disinformation. I think we used to call it propaganda at one time. And we always had snake oil salesmen, so to speak, offering all kinds of medication for curing illnesses, as a panacea for illnesses. And I think, none of that is new per se. I think what is new is what I would like to say is three things maybe. So one is the scale at which misinformation or even say disinformation is taking place, right? I think because of new media, the sheer scale at which this can start at one point and become mainstream pretty quickly. That's because of the second factor, which is so-called network effect. Because of this connected health and a connected world, it could, start in some obscure corner under some conditions, not always, but under some conditions that can go mainstream. And the third problem, I think, which is not always appreciated, is we learned it in the context of COVID-19. But it is true about science in general. The compressed nature of scientific the knowledge production. If you look at the number of papers, including preprints, etc., in publications, the last time we looked, there was something like 150,000 papers on COVID-19 or publications of some kind within a very short span of time, within a year. So, and the guidelines are changing because the science is evolving, the recommendations change, and it's very frustrating for people who, if they are following this, trying to understand how can they learn what is true, what is not, especially when the recommendations change. I think, so these are the reasons I think we have this perception there is a great deal of misinformation and disinformation. It is true. That's because of these conditions I just talked about, those three reasons. But we have always had this problem, especially in non-communicable diseases and infectious diseases, including cancer.
And Dr. Vish, the added problem that you have within the health sector and the cancer community, of course, is that you're dealing with vulnerable people as well, vulnerable people who are being subjected to and are perhaps seeking out this alternative information, alternative facts, as we would call it in journalism as well, which makes it that harder then, doesn't it, to sort of dampen people's spirits potentially and say, sorry, but the thing you've just looked up that you think is a cure is just not true.
Right. Right. So let me start with the statement: alternative facts are not facts. Right?
Exactly.
So, just like we used to say, right? Fake news. Fake news is not news. So you're absolutely correct. I think particularly you look at globally, among countries, even within countries, certainly we have tremendous disparities in cancer. Certainly people from lower socioeconomic position or certain geographies, certain classes and castes suffer disproportionately more. And part of the reason I think is information related. Part of the reason is access to medical services and healthcare services. And particularly for us, among in this panel, of interest to us is how the risk-producing industries target certain groups of people, like low income, lower education groups of people. Now, tobacco industry itself, in the US alone, they spend something like, the industry spends something like more than $9 billion a year marketing, right? And we don't even have the global numbers, and particularly targeting groups, sowing seeds of doubt around risk factors. So you're absolutely correct. I think between the risk-producing and communication industry, advertising and marketing, and the lack of access to services, and the nature of science that constantly evolves, for legitimate reasons. You just saw the colorectal cancer and aspirin, last week. All these things, combine to make it very difficult for people whose job or life is not keeping up with the science every day because they are busy with their own lives.
And Dr. Vish, I mean, some countries, some cancer societies, they just simply won't have the capability, the capacity to be able to tackle and manage misinformation where it exists as well. So how do we then go about building that capacity?
Right. So this is a multifactorial problem, as I say, right? So number one, I personally think, this is one person's point of view, putting the onus on individuals and asking them to sift the wheat from the chaff, so to speak, and be careful about misinformation and disinformation is unfair, unreasonable burden given the media ecosystem. So where do we invest? I certainly agree with you that one entity like the cancer societies themselves may not have the capacity. But I think it's a combination of things, right? Number one, we need to work with the platforms. I overheard the conversation you had with Dr. Garth Graham, right? Platforms are extremely powerful. They have the computational power, and they can be a great source of reliable information. In fact, I know that YouTube has been making very earnest efforts at this, especially in the context of COVID-19. You cannot eliminate misinformation or bad information, but platforms can help. So, we have one thing we have been doing. In India, we tried an experiment where we have been training journalists. We trained 200 journalists on how to cover science and health and how to access information, including PubMed. Investing in government, frontline health workers and building capacity among them is another way to do it. And again, I'm being very superficial. I'm giving you a 30-second response to each of these things. And lastly, our healthcare system. We expect a lot out of our healthcare work providers. They are taking care of the patients, but we should also think about how to build a system around them to support them, because ultimately the patients trust them. Study after study shows patients trust physicians in every part of the world. And it's very important for us to really create that ecosystem. So those are the four things one can do to build that capability and capacity around communications.
And Dr. Vish, just before I bring in your fellow panelists as well, I'm wondering about the equity considerations that you need to take into account when it comes to information.
To me, everything revolves around equity. Equity is central to everything we do. COVID-19 has taught us very clearly, right? I think we did not talk about equity issues until well into the pandemic. Pandemic started sometime in December. We saw some news items. Then in January, we began covering the issues. We haven't talked about equity until late into the pandemic. Same thing with the vaccines. We knew that equity isn't going to be an issue. Why didn't we do anything about it? Why didn't we plan for it, right? We are still discussing vaccine equity issue today. Same thing with cancer. We know right? More than 50% of the cancers can be prevented with appropriate preventive actions, right? How is it that we are not able to get that information, get the system in place to prevent cancer in the first place, right? So to me, equity is central to everything we do and everything we should do, including information, because we have very good data that people have. Let me give you one illustration. People are very busy with their lives, right? So they're not waiting every day to say, okay, what can I learn about cancer today? What they're doing is they're wondering and worried about, do I pay the rent? Do I take care of my children, my family? Do I get the money for medication or something else? So these daily struggles and hassles in life is what preoccupies them, right? So that stress will deter them from processing information on cancer or other health issues. So we need to be sensitive to where they are and work with that. So to me, equity is central to everything we do in the world of cancer communications.
Dr. Vish, thank you very much, and stand by because we're going to bring in your fellow panelists, and then we've got some Q&A also from our audience as well. So I want to bring in now Emmanuel Collin. You are the Director of Communication and Information at the French National Cancer Institute. We're so delighted that you could be with us for this World Cancer Leaders Summit, so thank you. Tell us first of all the role that new media plays in your overall communication strategy.
Well, the new media is pretty much at the heart of our communication ecosystem. At the very heart of our communication lies our website. It's really our information center, I would say. We have about 12 million visits per year. So it's when it comes to France, it's a huge number. I mean, we are around 60 million people in France, so 12 million visits is really important. And around this website or site, this site, we have developed a lot of social network site or social network. We open on Facebook, on Twitter, on LinkedIn. For example, we have more than 200,000 followers on Facebook. So once again, it's pretty important when it comes to French figures. So yes, because we know that, and it's probably global. It's not only France, but social media is really is the main source of information for most people. In France, for example, we know that more than 70% of people use social networks to get their daily news. And that's far ahead of the figures for TV. I think TV is less than 50%. So we see that, and I suppose that it's even the difference is even more important in the US probably. So we see that today, and it's been probably a long time now that it happened, social network is really the main source of information. So we have developed our tools and our ecosystem around this idea because it's the information system of the world and of the people that has changed. So we have to adapt.
Yeah, Emmanuel, you said that I think 70% you said of people in France are actually accessing social media to get their health information. Is that age dependent? Is that up to a certain age, or is?
Well, the figures we have it shows that this is particularly true for people under 40. So that's true.
Okay.
That there is an age factor, but we know that more. This age factor is diminishing little by little, and we know now that the penetration of social network, the penetration of mobile phone, and the penetration of mobile internet is increasing very, very fast in the older population. So it's particularly true for younger generation, but it's gradually becoming true for everyone.
How do you, broadly speaking, how do you counter the rise of fake news when it comes to health information?
I would say that the first part of our strategy was probably around I would call it education. So it's I might use a term that you Anglo-Saxon are using pretty much, which is pre-bunking. So before,
Yeah.
and I'll come back in a while on the debunking part, but the pre-bunking is all about bringing the right information to the population as broadly, as easily and make it as accessible as possible. So I was talking about our website, and our website is really the core of that. I mean, our job is really to bring the information about cancer in a very accessible way, and it's also about um, I would say packaging the information that we're bringing to the people, because I think I know that this has been researched and explained quite a lot, and the phenomenon is very complicated. But when it comes to fake news, part of it is fake news is also coming from the fact that people are looking for simple answers to complicated questions, I would say.
Hmm.
And I think we need, when I'm talking about packaging our information, I think we need to keep that in mind. People, they want answers, they have simple questions. I'm not saying we should bring simple answers, but we should make sure that the answers we're bringing to the people are easy to access,
Hmm.
easy to understand. So we are paying a lot of attention on our content to make sure that they can be understood by everyone. So we're making a huge use of video, of podcast contents, for example, which we know are a very good complement to written content. So that's part of the work we are doing to make sure that the information is coming across even before the fake news arrive, I would say.
Yeah, and so I guess it's not about dumbing down, is it? You're not trying to patronize your audience at all.
Of course not.
You're trying to listen to them. But I'm wondering, in my job in journalism, we have to present all sides of the story because that's what the story is, whether it's true or whether you believe in either side or not. That's irrelevant. You present all sides of everything that's been spoken about and discussed. I imagine, and tell me if I'm wrong, but that's harder to do in a health scientific community because there are empirical facts. There are things that are true and there are things that are not true. Do you find that you're in the position that you still have to present the falsehood in order to show that that you're listening, and then debunk it in the aftermath of showing that, this is the conspiracy theory that's out there at the moment and this is why it's wrong? Or do you just flat out ignore the conspiracy theory and just say what the empirical truth is?
Well, that's a very good question. And it's pretty much at the center of what we're doing. Well, I would take two different examples. The first example is the topic of screening. When it comes to screening, be it breast cancer or colorectal cancer, we know that there are a lot of information, misinformation, but we are paying a lot of attention when it comes to explaining to explain the benefits and the risks. So screening is a good example where we take into account the fact that people hear a lot of things, that what they hear leads to questions, and we have to answer these questions.
Hmm.
So I wouldn't say that we are advertising fake news because that's probably the limits. There are some theories or some facts that we wouldn't like to really talk about, but people have questions, and I think we need to take them into account and answer those questions. So the job we're doing, for example, on those on cancer screening is really packaged to make sure that people understand that yes, there may be risk. We're not ignoring them. You have questions. Those questions are very valid, and we are
Hmm.
going to try and answer those questions. The other part of the job we're doing is, I would say, pure debunking. So this year, we launched a fact-checking section on our website. So this section is specifically dedicated to fake news. So I would say it's the harder version of the thing, which is really we're trying to um, yeah, really answer all the fake news that we see, and we decided to take the most the ranking that we have. I would say is the harm that we see in a fake news. Some fake news are, I would say, annoying. They might be funny. Some
Yeah.
are dangerous. Some fake news are
Damaging. Yeah.
extremely, yeah, damaging for the health. So we started with those fake news when we see that there is a real danger for the population, and we explain why this is a fake news. We explain why we give the people the enough knowledge and inner um, I would say easy enough to understand
Yeah.
version so that they can really understand. Okay, I understand now why this is a fake news, and I shouldn't trust that. And we also try to explain as simply as possible in normal terms the scientific consensus, because it's pretty important, trying to make science understandable by everyone. So
Yeah.
that's not as easy.
And presumably going forward, then your plans for the future are to embrace and engage and find new ways of using new media to that effect.
Yeah, well, we have also. I didn't mention that, but when it comes to education, we have launched a video game this year in order to educate the youngest generation, the children under 15, on cancer risk factors. So there was really a use of new media to try and have our message go across on that target. In terms of future, we have several projects. We are first thinking about an app. So there would be a mobile app which could help us take the right habits in terms
Hmm.
of cancer prevention. So if you decided, for example, to reduce your alcohol consumption, well, one day you make a decision because, for example, you have seen a campaign, but the app would help you change your routine and make that decision last on the long term. It would be the
Yeah.
same for physical, physical training, or for eating, diet. So this app is the first area where we're investigating. The other big project that we have is to make a new version of our website with a much more, I would call it, audience centric
Okay.
version, so
Yeah.
that the site, for someone who is a scientist or a health professional, you would have a different level of language. Of, I would say, you of course you would be more sophisticated in the terms you would use, but when it comes to the general public, when it comes to the younger generation, then you would adapt to these people. So it
Yeah.
wouldn't be one single site for everyone. It would be different sites for different types of population. So that's
Emmanuel,
a
I'm
big
gonna.
project that we have.
Yeah, and thank you for explaining it as well. But because time is quite tight as ever, I want to bring Dr. Vish back in as well and get to some of the questions from the audience. But thank you very much, Emmanuel, for your contribution so far. First question, and Dr. Vish, let me bring you back in for this one. How can we communicate across political divides? And the question goes on to say, where there's waning trust in traditional media, which obviously, I'm familiar with, let's say. It's often that people are drawn to their like-minded bubbles. So how do we communicate across these political separations?
Sure. So I think there's good news and bad news here, I think. So we should not look past the good news, which is actually most people are paying attention to fact-based, science-based information, especially wherever there is epistemic consensus, as people say, scientifically verified facts. And as you know, most people are compliant with guidelines, whether it's wearing masks, getting vaccination, etc. So I don't think we should overlook that. So the question then is, among the non-compliant, that's where the hyper-partisanship is coming in and playing a big role. I think to a large extent, as you mentioned, the echo chambers and the filter bubbles and whatever term we want to use, term de jour, so to speak. The fact is, a lot of it is driven by social media platforms. It's not the individuals, right? I think there are always groups. These groups have always existed that have been advocating anti-scientific positions and stances. Vaccine hesitancy has always been there. People who questioned cancer screening have always been there. That's not new. What is new is the scale, as I said earlier. And this is where the platforms have a significant role to play. As you know, you are both following the information as much as I am doing. It has become increasingly clear over the last few weeks that the algorithms that these platforms have developed and fostered on people are generating that kind of a hyper partisanship, forcing people down that rabbit hole. I think it's really critical. I think we need to take a very close look at these platforms. As a journalist and as someone who has been taught by professors in a journalism school about the importance of free expression, it makes you uncomfortable to say, okay, so do we want to begin regulating? What does the word regulation mean? The fact remains that this is beyond the issue of regulation, that it's clearly driving that something is out of the control, whatever they created as a part of developing or drawing and engaging the audiences, they have lost control of it. And it's very clear that instead of putting this responsibility on people, we need to really take a very close look at the social media platforms.
Yes, I would say as well that
go ahead.
My apologies, Dr. Vish. I'll let you finish, but let me just say this one thing, because you mentioned there about the different platforms, and obviously the question in particular here is about the waning trust in traditional media, and that's sort of my genre, if you like, in traditional broadcast news.
Right.
There isn't so much trust in traditional media at the moment, and that's something that all of us in my sector have to deal with right now. But especially as a British journalist, I come from an environment of impartial journalism, of showing all sides, of never taking a particular side, but just presenting all of the facts and letting everyone have their viewpoint. The problem that you have then is that when you have all these social media platforms popping up everywhere, they are more inclined to go for a niche audience and to really cater to those kind of like inbuilt belief systems or whatever it might be that the customer has. And I think that the one thing that I would say on this point is that from the tradition, in defense of traditional media, the likes of Christiane Amanpour, who's my hero at CNN, for example, she always says that we are, and this is even operating in the US where there isn't such a demand for an impartiality, as it were, with cable news. But she would always say that we are not it's about being truthful, but not neutral. So you can still remain impartial and still retain good journalistic ethics, as it were, by not necessarily, you don't take a side, but you're also not neutral on it. So if something is empirically false, if it is just simply untrue, you have to represent that as part of the story. And I think that's where traditional media has a really important role to play, in that you're not catering to a specific group. You are just presenting the facts as they are. And that's where traditional media, and I would argue then the science community and the cancer community, can come on board together to make sure that we can debunk together conspiracy theories, and be it around vaccines or cancer treatments and the like.
Right. Absolutely. So I'm not trying to be Pollyannish here, right? But I do think we have to differentiate between mainstream major groups of people who do follow traditional media, who follow public health guidelines, who follow medical health guidelines, and who do all the right things. And so there is a group, a large group of people who are doing that. And traditional media, our data recently clearly showed, if your main source of information on COVID-19 is quote unquote mainstream media, you are much more likely to be compliant on vaccines. You are much more likely to be compliant on public health masking, for example, right? So what I don't want to say is overlook the role traditional media, so-called traditional media, are playing, and the credibility they continue to have. I think because I think we get too depressed, we get too worried about that we are losing the credibility. Actually, survey after survey shows that mainstream, New York Times or Washington Post, CNN, all these are highly regarded. Every survey shows scientists and medical professionals are highly regarded. They have a lot of trust. So it's not that it's not there. What we need to do is figure out which group of people don't trust this media, which group of people are chasing the rabbit hole, going down the rabbit hole, and focus on them. What is it we can do with them to make sure that they are getting the right information and right support?
And Emmanuel, can I put that question to you as well? That how do we best communicate across political divides?
Well, I think always that has been said, I fully agree. I also believe that, at least in France, the COVID-19 pandemic has shown that there still is a very strong credibility of traditional media. So I think if you jump to a conclusion saying that the world has changed and it's a bit too late for traditional media to regain credibility, I don't really think so. I think there still is a huge credibility of traditional media. I would like just to emphasize the fact that we probably need to use the new media itself in a dissemination strategy. I don't know if that is the correct word in English, but for example, in France, at the French Institute of Cancer, we're using influencers now. We're doing so for about a year and a half, and it's very new. But we're spreading our messages across traditional media, of course, but we're also using, I would say, the natural peer-to-peer spread of information. So we're using influencer. I was referring previously of that video game we launched on the youngsters, and we didn't launch it on traditional media. We don't launch it on with a TV spot. We use influencers who are um, credible on a 10, 14-year-old target. And it worked. I mean, so I think it's all about also changing the way we use all those tools. I think, it's been said that in the probably in the 40s and 50s, that when TV arrived, radio said that's the end of radio. But we see that every time there is a new media, it's not, the old media are staying, or the previous media are staying. It's just they probably need to adapt. But so we're using the whole spectrum. It's just that it brought us new tools. We're still in the process of learning how to use them correctly, probably. But it's growing. We started.
The longer old media sticks around, then the better for me. So that's all great. Another question to you, Emmanuel. This is coming from our audience as well. I think this is particularly in light of you talking about trying to reach children, young people. The question starts with a statement: showing the other side is not right. Giving equal time to both sides of the issues is only right when there is no consensus by experts. But when the other side is totally false, for example, flat earthers, should they be given equal coverage?
I think that's what I said. When I took the example of screening, cancer screening, I think it's not about spreading false information or giving equal time to false theories and scientifically proven theories. It's all about answering people questions. So yes, it's true that part of the and research after research, we see that people understand or fear that there might be some risk when it goes to, for example, cancer screening. So, and yes, there are risks. So we believe that we need to answer those questions. So we really try to show the benefits and the risk. It doesn't mean that we're not doing our job, but we are trying to explain, give the information so that people could make a choice. I think this idea of as you say in English, I'm looking for the word, but um, ma- making sure that you make your own decision. I think it's very important, you know.
Yeah.
So that's exactly what we're trying to do. We are paying a lot of attention not to advertise fair theory, and that's true. That's the limit. If you counterattack a theory, you're advertising a theory, and you're making communication for the wrong theory. But that's not what I'm
Yeah.
saying.
No, I understand what you're saying. And I think as well, I'd add to that, that in traditional broadcasting, for example, in the UK in particular, which is sort of what I'm used to, then in the run up to, say, a general election or something like that, you do give equal time to all of the different parties, because there is no empirical right or wrong for what their political manifesto might be. But at the same time, when it comes to conspiracy theories that have no grounding in fact or anything, you wouldn't see the BBC or Sky News or anyone else giving equal time to hearing conspiracy theorists, for example, talk about anti-vaccines or something like that. So it's about balance, and it's about listening to people and presenting the facts and the facts of a story. And the facts of a story might be that that the protesters are gathering to have their voice heard about something which isn't rooted in science. You can tell the story, the fact that people are there protesting, but you don't necessarily give the same amount of airtime to the claims that they're making. So it's about balance all the time, which a lot of people watching will probably might find quite difficult to digest, because it doesn't necessarily, it's not satisfactory. It's not an equal split all the time. But that's just the nature of the media and the landscape that we have to navigate at the moment. Vish, another question for you. At the end of the day, social media is driven by engagement. It is more profitable for the social media companies to have these echo chambers. This obviously can lead a cancer patient to go down a rabbit hole of bad information. So what's the solution to this? Is the solution regulation?
All right. So the two issues, right? So when it comes to general information, it is quite conceivable that they will, social media is part of the information ecosystem for people. But social media is not the only one. I think they also go to their physicians and healthcare providers. They listen to family and friends. They listen to coworkers, right? So to me, I think, it's again a solution that requires a multi-dimensional response. I think the platforms have to take responsibility, at least on certain things, right? So also, building on what you asked previously with Emmanuel, right? There are no two sides. If there is a myth called if exercise, physical activity can undo the effects of smoking, right? There are no two sides there. There's only one side, and that is a side of facts, And I think on those issues, I don't think there will be major arguments from anybody. I mean, anybody sensible, mainstream folks, that any information outside that doesn't make any sense, and platforms should pay attention to those kinds of things. But also, I think, when it comes to decision making, I think, again, people go to healthcare providers and listen to family and friends. So we should try to also build that side of the ecosystem. So it's regulation of the platform, and regulation is a very loosely being used here, certainly on social media, but also strengthening our other healthcare system, the National Cancer Institutes of the world, for example, the cancer societies, etc. So,
yeah. Emmanuel, I have one final question then for you. How can organizations engage with the media? How can cancer organizations, for example, become good partners with media?
Well, that's a vast question, a broad question. I think the media are between us and the public. So I think probably our role is to make sure we answer the question the people are asking us through the media.
Yeah.
So, for example, at the French National Institute of Cancer, we have an extremely active PR policy. I mean, it's I wouldn't say hundreds, but it's not far from hundreds of thousands calls per month coming in from media, and we're trying our best to answer those calls because every call from the media is potentially a message, a conversation with the public, and I think what this new media is all about it's pretty much also about conversation. I think people are fed up of authorities that are giving lectures to them, or telling them story that they should believe because we know and you don't know. I think people want to have kind of they have questions they want answered. They would like to have a more horizontal conversation, and I think the traditional media also help us have that kind of conversation with the people. So that's the way we try and answer the question that we're having with the media. We're very open to any kind of question. There is not a good questions and bad questions. There are questions, and probably those questions are just coming from the society itself.
And it's very interesting that you say that, Emmanuel, because from my point of view as a sort of media strategist, then I would say whenever I have people coming to me saying, how do I get this into this newspaper, or how do I get coverage on this particular issue, it has to come back down to people, to human stories, to real people and real things that the public can really grasp onto and relate to as well. That's what media is all about, whether it's broadsheets or whether it's Facebook or whatever else, any other platform that it might be. It's been such a pleasure to speak to you both, to Dr. Vish and to Emmanuel. Many thanks indeed for joining us at the World Cancer Leaders Forum for this fascinating discussion on health and the social network, which of course will shortly be available on demand in the digital library on the Summit platform.